Hi, this is Bill Fera, Generative AI Healthcare Leader at Deloitte. Today I'm coming to you from HIMSS 2026, where I have the pleasure to be interviewing some of the most influential healthcare IT leaders in the space. And right now I have the pleasure of being with Allyson Fryhoff.
Well, thank you, Bill. It's such a pleasure to be here with you.
Talk a little bit about what you do at AWS.
So I lead our global healthcare and life sciences team, where we try every day to empower providers, payers, biopharma, medical devices, and all our health technology companies to have a positive impact in the world.
We've talked about this. HIMSS can be a little bit overwhelming. There's so many things happening, so many new things that are being brought forward. What's the one thing that you've been the most excited to see so far?
What I think is really exciting is last year we were talking about AI a lot. And in this past year, we're going from proof of concepts to real production instances. And as a matter of fact, AWS made an announcement about Amazon Connect Health. So we're introducing agentic AI capabilities for our provider customers. So that's been super exciting.
That is exciting and great timing. So if you could tell one client the most important thing that you have to say about AWS at HIMSS, what would that be?
Well, I think it's data. We always go back to that because AI is exciting, but if you don't have your data set up appropriately, if it's not in the cloud, if it's not accessible appropriately with the right permissions, then you can't really take advantage of all of this new innovation. So we like to talk about, I know you and I talk about it a lot, how do we really work with our clients to make sure that they have a modern data strategy that allows access where appropriate, obviously has the guardrails around it, but allows for all of that data to be used.
Yeah, and as overwhelming as that can be, at least we have the tools to make that more accessible in terms of AI readiness and data readiness than even 10 or 15 years ago.
Absolutely, and it's an imperative now. So where we used to talk about, it would be nice to have that data accessible, it would be great to have that data, it is absolutely critical now for organizations to think about data differently and to think about data as an asset for that organization, for the company, because it is critical. And it used to be every department held on to their own. And so the technology is there today to have this incredible data strategy with the appropriate guardrails and permissions, but also appropriate accessibility. But it's the people and the change management, which I know you and I talk about a lot, and that your team works with a lot to say, how do we really help people think differently and how to utilize that data?
Thank you so much for being here.
Oh my gosh,
always
so
a
great.
Pleasure.
Thank you.
That's all from HIMSS 2026 for now. Thanks for listening in.